Okay, thank you everyone for joining. We have a record-breaking number of participants at this webinar. So really glad that folks are joining us. So this is a special webinar that we are hosting. So CalABLE, we have monthly webinars on a range of different topics, but we're doing an extra special one in partnership with our Medi-Cal friends over at the Department of Healthcare Services to really it's dual purpose. It's to let people know more about CalABLE if you don't know about CalABLE. It's to let people know more about Medi-Cal if you don't know about Medi-Cal. And if you don't know about either, great, you are in the great spot because you're going to learn about both. So my name is Thomas Martin. I'm the executive director of CalABLE. I am autistic, so are both of my kids. All three of us, we each have a CalABLE account. So this is very near and dear to me, to my family. And so as we go along, we'll explain a little bit about how CalABLE works. Then we'll shift gears and listen to our Medi-Cal friends walk through how their program works. And throughout this, we'll be talking a bit about how CalABLE and Medi-Cal work well together, what some of the eligibility standards are, some things to keep in mind, all that sort of stuff. So before jumping into some of the Medi-Cal stuff, let's chat a little bit about CalABLE and how CalABLE works. So, for those who aren't familiar with it, which sounds like a decent number of people probably aren't, CalABLE is a state savings program for people with disabilities. So this is a state program. I'm a state worker, just like the Medi-Cal team here. Um, and the goal is to help people with disabilities be able to save money, invest that money, and protect their benefits in the process. So as we go through, we'll talk more about all the different aspects of that and what that looks like. First things first, so let's talk about why you might want to have a CalABLE account. Um, so a couple things to keep in mind, a couple reasons. One is simply that having a disability can be very expensive. There's a study from a few years ago that said the average person with a disability has about a 29% greater cost of living expense to maintain the same quality of life as someone without a disability. And for plenty of people with disabilities, that can be significantly greater. So CalABLE can help you save and plan around that. Um, Maybe it's because you want to protect eligibility for benefits, which we'll get into shortly. But that's a major positive for the program. Or just simply you're just looking for the best way to be able to just kind of plan and plan for the future for your financial well-being, whatever that may be. Any of those cases, CalABLE is a good vehicle for you to think about. So let's talk about benefits. So um, I know we're here to chat about Medi-Cal, how we interact with Medi-Cal, but also want to highlight some of the other benefits programs that CalABLE can help with. So for those who aren't familiar, when you apply for some benefits programs, there are asset limits, so limits on how much money you can have at any given time. I think the most present one, the one most people think about is SSI. So that's supplemental security income. That's kind of the main disability pay that people think about when they think about disability benefits. That comes from the Social Security Administration, and that's to support someone with a permanent disability. Um, in order to qualify for SSI, you can't have more than $2,000 to your name, which is a huge limitation, right? So if you're trying to qualify for SSI, you can't have more than $2,000 or that can affect your eligibility, which means you can't really save money for major life expenses. You can't save money for an apartment or a car or emergencies or really much of anything. $2,000 doesn't get you very far. And so uh, it's very limiting. It prevents people from being as independent as they can be. But that's why a program like CalABLE exists. So CalABLE allows people to save up to $100,000 and keep their SSI eligibility intact. So instead of 2,000, you can save 100,000. and be able to do all those things I mentioned. Plan for an emergency, save for an apartment, all those things you can do with a CalABLE account that for most people you simply wouldn't be able to do otherwise and still keep those benefits intact. So me as a parent, this is how I'm using CalABLE. I'm using it to save for my kids, so that when they're adults, if they're receiving SSI or other benefits, they can keep those benefits intact and have a nest egg saved up. So that also applies for any other program that looks at assets or as part of your eligibility. So again, SSI being the biggest one, but also CalFresh, um, which is food stamps or Section 8 housing choice vouchers. Um, and then starting next year, which I know that the Medi-Cal team's going to talk about a little bit, Medi-Cal is going to have an asset limit of $130,000. But again, CalABLE would be exempt from that. So you can have money in your CalABLE account and not have it count towards your Medi-Cal asset limit. So it's a way to be able to keep saving money and protect your eligibility for benefits at the same time. So we do have a lot of account holders who receive Medi-Cal now. This is one of our ambassadors, Tiani, and this is a quote from her. As a Medi-Cal recipient, maintaining my benefits is crucial for my health and well-being. The CalABLE account offers a safe way to save for important needs like a service dog and home modifications without affecting Medi-Cal eligibility. This brings peace of mind and the ability to plan for a better future. So that's the goal. The goal is to help people be as independent as they can be, just like Tiani, while still protecting access to benefits. So, um, Uh, speaking of CalABLE account holders, this is Otto. Otto is one of our CalABLE ambassadors, and he's in addition to using it to think about protecting benefits, he's also taking advantage of another major benefit for CalABLE. So it's not just being able to save money in a CalABLE account. You can also grow that money tax free using the different investment options. So basically, you have there's 8 different portfolios that you can pick and choose from, and you can decide you can mix and match. You can decide how you want to save and invest your money. And anything you earn in the portfolio is tax free. Anything grows tax free as long as you're using it for qualified expenses. That I'll get into in a bit. So really, it's not just about saving money. It's about how can you grow what you have too and plan for the long term. And so, quick quote from him, CalABLE has given me that tool to be able to invest in my future just like everyone else. So it allows people with disabilities to have access to things like investment vehicles that normally, if you're trying to protect benefits, normally you simply wouldn't be able to do. So that's some of the reasons why you'd want CalABLE, and we'll go through each, as we go along, we'll expand on those. But first, let's talk about who can have a CalABLE account. So something you want to keep in mind, you have to be eligible in order to have a CalABLE account. You need to have an eligible disability, which means one of two things. One is that you're eligible for SSI or SSDI, Social Security Disability Insurance. So if you're eligible for one or the other, um, then your disability is an eligible disability. However, you don't have to receive those benefits or any other benefits to have a CalABLE account. So like I have an account, I don't receive SSI or SSDI, but I can still self-certify. So we have more information on our website. You can see the link there, which is calable.ca.gov/eligibility, or you can just go to our website. There's an eligibility button right at the top. That'll provide you with some more information to look up and see if you have an eligible disability. So like I can go on there, I can see that autism is a allowable diagnosis, so I know I'm good to go. So that's kind of step one. You have to have your disability has to meet one of those 2 criteria. The other thing to think about is also when the disability began. So it doesn't matter how old you are today. It matters when the disability itself first started. So like I'm autistic, my disability started at birth. Um, Really, what matters is if you have a disability that started before the age of 26, then you know you're in. Then you know you're eligible for CalABLE. So that's the requirement today. So again, doesn't matter how old you are today. It just matters when the disability began. And if it began before age 26, you can have an account today. Now that's actually expanding. So next year, starting January 1, you can have a CalABLE account if your disability started before the age of 46. So it goes from disabilities before 26 to disabilities before 46. So if you have a disability that begins between the ages of 0 and 45, you can sign up. You can get a CalABLE account. So it's great. That means we're going to be able to expand who we can serve, who we can support, starting January 1. Otherwise, other than that change in age, it's still the same disability or same eligibility requirements. Again, you don't have to receive benefits. You can self-certify if you're not receiving SSI or SSDI. And whether you're working, whether you have income, how much that income is, none of those have any effect on your eligibility. And this is just an expansion of who can have an account. So if you have a disability before age 26, then great, nothing changes for you January 1. This really just means even more people can have access to the account. And this is because of a change in federal law that now allows us to sign up even more people. So that's who can have the account. Um, let's say you open the account. Let's talk a little bit about how it would work. So we go to the next slide. So how much can you save in the account? So a couple numbers to keep in mind. I already mentioned $100,000, right? So if you receive SSI benefits and you want to continue receiving SSI benefits, you can't have more than $100,000 in the CalABLE account. Otherwise, anything over that will start to count towards that $2,000 limit for individuals. Um, but that's just the number for SSI. If you're not receiving SSI, either receiving other benefits but not SSI, or you're just not receiving benefits at all, you can save up to $529,000 total. Um, now there's the third number to keep in mind is the one on the left. You can contribute up to $19,000 in a year, in a calendar year. So and that's the amount for 2025. So in the calendar year 2025, you can add up to $19,000 into the account. Um, and so that's your annual limit. That's the standard annual limit, I should say. And over multiple years, that's where you'd get up to either 100,000 or 529,000. Um, that's what you want to keep in mind. We do have something called the Able to Work program that allows you to save more than 19,000 a year if you're working and your employer doesn't contribute to a retirement plan. We have more information on our website about that if you're interested. But again, the basic limit is $19,000 per calendar year. One more time, that Medi-Cal will have an asset limit of $130,000 starting January 1. However, anything in a CalABLE account up to that maximum, up to the 529,000, that would all be exempt from the asset limit. Now, getting money into the account, something to think about. You can ask friends and family, whoever, to gift money into your CalABLE account. It's really easy to do. You set up a gifting page. It takes like 1 minute to do. And then you have a permanent link. You can forward that link to whoever you'd like. They can go in, they can contribute money. They can do it on a recurring basis, like every month or something, or you can just do a one-time contribution. Either one is fine. Um, but it makes it easy for anyone to be able to support you, or if you're supporting someone else, makes it easy to support them. So you would have to think about that $19,000 annual limit. Doesn't matter where the 19,000 is coming from. You can't go above that amount, even if it's whether or not it's a gift. However, something to think about is if someone gifts money into your account, it doesn't count as income to you. if you're the account holder, right? So it doesn't count as income for tax purposes. It also doesn't count as income for benefits purposes. So some benefits programs will look at money given to you by someone else as a resource, like SSI. So if someone's helping you pay rent, for example, that could be counted against you as income. However, if the money's put directly into the CalABLE account, then that gift wouldn't count as income. So just something to keep in mind that can help you protect eligibility for benefits. So with that, another quote from one of our account holders, Hector. Hector said, "For my birthday, I asked folks, this is my ABLE account. You can make a donation. And I ended up getting enough money to put down a down payment for a 2-bedroom, 2-bathroom mobile home." So, Hector was able to save up this money despite asset limits, despite a $2,000 normal limit on SSI, for example. He was still able to save up enough money to put down a down payment for a home because he was able to get gifts from friends and family over a few years. So it's something to think about. Again, this helps people be more independent, and helps people support each other. So when the money's in the account, I mentioned this earlier briefly, but again, you can pick and choose from a range of investment portfolio options. So you can add money into the account. You can choose from the different options. One of them is FDIC insured. It's similar to like a savings account. Whereas the 7 other portfolios are a mix of stocks and bonds and securities. And so you can mix and match. You can decide what you feel is most appropriate for your situation. And put your money into each of those portfolios that you'd like. We do have fees on the account. The fees are $30 plus per year, plus a small percentage of what you have invested, and that percentage varies based on the different portfolios you choose. So there's a fee, but we do try to keep it as low as we can. This is a state program. We want to make it accessible to people. So we do keep as low as we can. And some of those fees can be offset by that tax benefit. So like I mentioned earlier, anything in the accounts, anything that grows tax-free. So both state and federal taxes. So it's a big benefit to be able to save for the long term. You just have to make sure you're using for qualified expenses that we'll get into shortly. And if you want more information about it, you can check out our website, and there's more details there. So another quote from Otto again. And this is about how we use it in conjunction with Medi-Cal. Medi-Cal is a lifesaver. I take very expensive medication and it is not covered by my regular medical insurance. So my Medi-Cal covers my prescriptions, my deductibles, and my copays, plus in-home supportive services, IHSS, and allows me to choose to live at home with my parents instead of an institutional or group home setting. It is my authentic life, and I am living large. So he can use this combination of CalABLE and Medi-Cal and other benefits programs to be able to save money, and do it while protecting benefits at the same time. He gets his medical support, and he can save for the long term. So what can you actually use the money on? So, talked about you can open the account, you can put money into it, others can help you save, you can invest it. What can you do with the money? I know a lot of folks are asking this question. I can briefly see it in the chat. So here's what you want to think about. The account needs to be used for the benefit of the person with the disability. It needs to benefit their health, independence, or quality of life. Now, those are pretty broad categories. Health, independence, quality of life are very broad categories. And it pretty much will cover anything that's going to benefit that account holder. So that can be education, that can be housing, transportation, vocational training, of course, healthcare related things. If someone needs adaptive technology, but also, more day-to-day things like groceries, food, recreation, again, anything that's going to benefit one of those three things: health, independence, or quality of life. As long as it does as it does that for the person with a disability, then it's almost certainly going to be an appropriate expense. One thing to keep in mind is for SSI recipients. So if someone is receiving SSI, um, you do need to make sure that your housing expenses are withdrawn and spent in the same calendar month. I apologize, that makes it more complicated, but again, this is specifically for SSI. So if you're withdrawing money from a CalABLE account to pay for rent, for example, you would need to make sure that you withdraw it and spend it in the same month so it doesn't count as a resource. Um, but if you don't receive SSI, you wouldn't have to worry about that. So some examples of what you can spend the money on. If we go to the next slide, couple examples. We have two gorgeous examples specifically, Henrietta and Cleo. So Valerie is one of our account holders. Her service dog is Cleo. You can see them on the right. Henrietta is my kid's service dog on the left. They're very adorable. And they can also be pretty expensive. You know, when you think about all the expenses that go with having a service animal, of not just getting the service animal, which could be quite expensive, but also flying out to go get the service animal, and you know, the cost of a hotel. I spent several weeks training with Henrietta before we brought her home. um, Costs of vet bills, food, um, all those things, you name it. All those things can really add up. And obviously, you know, a service dog can be a really important thing for someone to be independent and to be able to access the rest of their community. But CalABLE is a great way to be able to save for those expenses, and you know, get the support that people need. This is mainly an excuse to show off my gorgeous dog, though. Okay, and so another example, and this can kind of illustrate how you can use it in support of someone else too. So this is Ashley and her son Dylan. Dylan got a bigger wheelchair, and then we found out it doesn't fit in our car. We realized that we had money saved in CalABLE, so we sold our old car and used the money in our CalABLE account to have extra money to buy a bigger, nicer car. It fits his wheelchair amazingly. Um, so this is a good example of another thing that you could spend the money on. Um, and in addition, another way to think about it. So this is Dylan's account. It's Dylan, you know, the money is for Dylan. His mom was able to buy the car, even though it's in her name, even though she can use the car, it's not exclusively benefiting Dylan, and that's okay. It's as long as it supports him, it supports his health, independence, quality of life, then it's going to be an appropriate expense. Okay, now that's what you can spend it on. So how can you spend the money? So a couple of examples that you can do. So one is you can transfer money from your CalABLE account into a bank account, a credit union account, something like that, and then spend the money from there. You can also have a check made out and mailed to you. So for example, if that's how you pay rent, you can have a check mailed to you and then use that to pay your landlord, for example. But the easiest, most convenient option I highly recommend, for personal experience, is the prepaid card. Um, you can get a prepaid card that's attached to your account. You decide how much money you want on the card, and then it's a Visa card. You use it wherever you use a Visa card. You can customize when and where it works, which is great if you're supporting someone else manage their account. So you can say, okay, well, I want this person to be able to use the card on their own, but I want to make sure that, you know, they use it at certain types of places, or they only use it, you know, $100 a day, whatever it might be. It allows them to be more independent and go buy things on their own. Or you can, you know, buy things for them, or if it's your account, buy it on your own. There's no fees on the card right now. We're covering all the monthly fees to make it more accessible. But really, this is a great way to be able to use your CalABLE account, you know, quickly and conveniently. So with that, hopefully folks are wondering how you actually open the account. Hopefully, you've done a good enough job explaining why it's important. Um, so it's pretty easy to do. This is our website here, calable.ca.gov. If you go to the website, you can see some of the links at the top: eligibility, investment options. You can join the mailing list, but the big thing is the big gold button in the middle, open an account. If you click on that, that will take you through the process. And it's not terribly different from like opening a bank account or something like that. Um, so, what does it take to get started on the account? Um, so it takes about 15 minutes. I did mine in probably less than 10 minutes. Some things you'll want to keep in mind. You'll need to have some basic information, probably exactly what you'd expect. So name, date of birth. You do need either a social security number or a tax ID. So you don't have to be a citizen. You just need to have one of those two. Address, that sort of thing. So you'll need that kind of basic information. You'll also need your eligibility information. So if you receive SSI or SSDI, you'd check one of those boxes. Or if you're, again, like me, you don't receive either, if you're self-certifying, you would say that. We do highly recommend getting a physician's note if you're self-certifying. I'm just saying that you have an eligible disability, and we have more information on our website about that. But if you receive SSI or SSDI, that's easy. You just click on one of those buttons. You'll see a part where you have to enter a diagnosis code. This is just for data tracking purposes. We're required to do that. It might not always be clear where your diagnosis should fit, and that's okay. Just do your best, pick the closest one that you think is most appropriate. And then as far as actually setting the account, you have to add $25 into the account to get started. And then you just pick the different investment options, whatever you're interested in, and you're good to go. Something we're really excited about, we've expanded the account so you can open an account in 20 languages. Spanish, Chinese, Korean, Russian, Tagalog, I forget what else, a lot of languages. So that's available. You can open the account and continue to manage it that way. Okay, so with that, I've done a lot of talking, and I want to introduce our co-state workers over at the Department of Healthcare Services. So let me introduce Brooke. Brooke, if you'd like to join in and get started with your presentation.
Hi, good afternoon, everybody. My name is Brooke Hennessy, and I am from the Medi-Cal Eligibility Division at Department of Healthcare Services. And I am joined by one of my colleagues from the Third Party Liability and Recovery Division, John Kennedy. And we're here to do a presentation for you about Medi-Cal and CalABLE. And I believe my portion is first up, so I'll be kicking us off. And so, I think that this was covered a lot by Thomas's presentation, but of course, California ABLE Act allows qualified individuals with disabilities to open tax-advantaged ABLE accounts in California under California's ABLE program, and it allows individuals with disabilities to establish the tax-free savings accounts without losing eligibility to public benefit programs. And of course, one of those programs is the Medi-Cal program. Next slide. And so we're going to start off with some Medi-Cal eligibility. And first, of course, one of the things that people want to know is if they have an ABLE account, will the county office know that you have an ABLE account, or is that something that you would need to report to your county office? And so this is something that you would inform the office about when you're either applying for or are a current Medi-Cal member. Medi-Cal does not automatically know that you have an ABLE account. And so you would want to provide information about your account so that it can be documented in your case file. And then after that point, once it's already been included in your information in your file, You don't need to report that every year at your annual redetermination. You'll just need to provide any information that would subsequently impact your eligibility. So if you make a contribution or any distributions that potentially would impact your eligibility from your ABLE account after that, then you would want to provide your county with information about that. For example, if you had a contribution such as your monthly income that you regularly deposited into an ABLE account, you would want to provide verification of those monthly deposits. And of course, a big question is, if you have an ABLE account, will your benefits be canceled? And of course, it does not disqualify you from having Medi-Cal, having an ABLE account, and it's one of the benefits. ABLE accounts, of course, allow you to keep your public benefits, and that's one of the great benefits of ABLE accounts, is that they allow you to continue to have save and have those public benefits, including Medi-Cal. Next slide. And so a big question and an area that potentially can be confusing about how income is counted when you do have an ABLE account is, you know, how do you treat any contributions to ABLE accounts? Can you put your monthly income in an ABLE account and have that no longer count as income for the purposes of Medi-Cal? And unfortunately, you still, under Medi-Cal eligibility rules, we still treat income as income for Medi-Cal eligibility purposes. You cannot reduce what counts as income each month by either having it directly deposited into an ABLE account or taking it from, say, your checking or savings account and then depositing it into an ABLE account. We still have to follow the income counting rules under the Medi-Cal program and treat it as it would be under our Medi-Cal eligibility rules. What doesn't count for ABLE purposes in terms of income is if you have income that results from the investment that's already in your ABLE account. For example, if you have income or interest or dividends as a result of that investment in the ABLE account, that doesn't count as income when you're growing the ABLE account. And I do have an example of how this works on the next slide. So for example, if the Medi-Cal member has their Social Security income of, say, $900 directly deposited into their ABLE account each month, that $900 would be countable income into that month, even though it's directly deposited into the ABLE account. And this would be the same if the member first deposited their income into the non-ABLE checking account and then transfers it into the ABLE account. We count their income that one time when it's received, and that's because of Medi-Cal eligibility rules. Next slide, please. But one advantage, and this is something that Thomas spoke to, is that if you do have other individuals, family members who contribute, and we call this third-party contributions, or I believe it was referred to as gifting from friends and family. If third parties make contributions to a person's ABLE account, those are not counted as income to the ABLE account holder for Medi-Cal eligibility purposes. So we have an example here of someone who is an IHSS provider for their child, And if they deposited that income that they earn as an IHSS provider for the benefit of their child into the child's ABLE account, would that count as income to the child for the child's Medi-Cal eligibility purpose? And it would not. That is one way to not have a gift or that contribution count in the Medi-Cal eligibility determination, because it is a contribution made by a third party directly into the ABLE account. So that is a great advantage of the ABLE account. Next slide, please. And so this is a question that we receive quite frequently regarding CalABLE and special Medi-Cal programs such as health homes, the Coordinated Care Initiative, and things like ACEs Aware. These are specialty programs that kind of fall within the Medi-Cal umbrella, and they're for different populations and have different qualification rules outside of the regular Medi-Cal eligibility determination. So CalABLE would be, compatible with these type of programs. What you really are concerned with is qualifying for Medi-Cal as a whole first. And CalABLE is very compatible with that general Medi-Cal eligibility determination. And then the enrollment for those special programs is a separate process. And that really is determined more on the individual's, medical condition, where you live. A lot of these are based on, geographic location, and then whether there is space in the program, different criteria like that. So CalABLE can work very well with these programs, but it's generally that you qualify for Medi-Cal first, and then you would enroll in one of these special programs after you've qualified for full scope Medi-Cal. Next slide, please. And this is something I believe that Thomas covered very well about the use of ABLE account funds for qualifying disability expenses. And so as long as distributions from the ABLE account is used for a qualifying disability expense, the distribution is not counted for Medi-Cal eligibility purposes. If it is used for a non-qualified disability expense, it may impact Medi-Cal eligibility, and the individual would need to report that distribution to their county office, and then the county would evaluate whether or not that distribution would count as income. And then once the asset test or asset limits are reinstated, whether it potentially could count as an asset as well. But that would be the change that would come, is whether or not that QDE distribution potentially could count. Counties do not make the determination whether or not contributions or distributions were for qualified disability expenses. They are not responsible for reviewing ABLE account contributions and distributions and evaluating whether or not something was for a qualified disability expense. Really, it's up to the member to report to the county any distributions they made that may have a potential impact on eligibility. And that kind of leads us to talking about the reinstatement of asset limits for our what we call non-Magi Medi-Cal programs. And so these are our programs that are for the population, for seniors and for individuals with disabilities, and individuals who are seeking long-term care in nursing facilities. And this change is effective, as Thomas said, January 1st, 2026. But the really important part that we do want to emphasize, of course, is that ABLE account funds don't count toward this asset limit. But it's important for everyone to be aware of the change because, of course, people do have assets that are not just ABLE account funds, right? So we want to make sure that the word is out about this change, and that individuals and family members are aware that this is coming up. The county will not be asking people who are currently on Medi-Cal for their asset information right at January 1. That will not happen until they have their next annual renewal in 2026. And the county will be using electronic databases to attempt to verify asset information to make this as streamlined of a process as possible, and only will request additional information from the member as needed. So hopefully it will be, streamlined and as least burdensome as possible as we go through this change. Next slide. And just as a reminder, as I mentioned, this is the population that is impacted by this change. Asset limits apply to individuals who are 65 and older, have a disability, live in a nursing home, or are part of a family that earns too much money to qualify under the rules that rely on federal tax rules, which is we've referred to as Magi eligibility. And so also, if you do receive your Medi-Cal through SSI, you would continue to have to meet the SSI limits. The asset limits did not change for those individuals. They still had to meet those SSI program limits and will continue to do so. Next slide. And I've just included some resources, and we will get these out to everyone. We will be sending an outreach letter and FAQ to all of the individuals who are currently eligible under a program that will now have an asset limit in January. And then our informational notice that includes all information about what assets are, how you spend down your assets. And then the DHCS website also has information on the web page about these upcoming changes as well. And then I think we have our contact information on the next slide, our inbox, if you have questions about any of the things that I raised. And with that, it'll be over to John to talk about estate recovery.
Good afternoon, everyone. My name is Jonathan Kennedy. I serve as a branch chief for the Estate Recovery Program with the Department of Healthcare Services. Today, I'll be providing an overview of the Medi-Cal Estate Recovery Program and how it relates to ABLE and CalABLE accounts. I'll walk you through the circumstances under which Medi-Cal may or may not pursue recovery, the specific limitations and exemptions, and under what conditions we would potentially recover. So first of all, Medi-Cal will not file a claim directly on the ABLE account. However, if those funds are just distributed to a person's probated estate, then they may be subject to estate recovery. Next slide. Medi-Cal State Recovery Program will only recover on assets from an ABLE account if they are transferred to a probated estate and only if all the following apply. The individual is a deceased Medi-Cal member over the age of 55. They leave an estate that is subject to formal probate, which as of April 1st, if California allows estates that are primary residence valued at $750,000 or less, or personal property under $208,850 to bypass formal probate. So if they're under those amounts, you don't have to worry about formal probate. If they are over those amounts, the personal property or the personal property is over that 208,000 amount, then you would potentially be subject to probate. The individual receiving also has to be receiving nursing facility services or home incubation services. So if they're just on Medi-Cal and don't receive that level of care, those types of services, there would be no recovery as well. Next slide. Additionally, Medi-Cal State Recovery Program will not pursue repayment if there's a surviving spouse or a registered domestic partner, a surviving child who's under age 21, or a disabled or a surviving child of any age who is blind or disabled. Medi-Cal will never collect more than either the value of the Medi-Cal member's estate subject to probate or the amount paid by Medi-Cal for benefits, whichever is less. And again, there's specific limitations, there's hardship waivers that may also apply. Next slide, please. And if you have any additional questions on the Medi-Cal State Recovery Program, this slide contains our website and contact information. We're happy to answer any questions you have. I think there's some questions in the chat I'm sure we'll be going over shortly, but that's, we're here to help and answer any questions.
All right, thank you. Thank you, Jonathan. Thank you, Brooke. Really appreciate it. Yeah, we heard a lot about how CalABLE works, how Medi-Cal works, and then a lot of those overlap areas. There's the asset limit that's going to start January 1 that CalABLE is going to be exempt from. Jonathan talked about the estate recovery that in most cases CalABLE can be exempt from as well. Really good to think about it as a good pairing between the two. So with that, we'll go through some reminders, some wrap up stuff, and then we can do some verbal Q&A. So to get a hold of us, you can give us a call at our customer service center. Our phone number is 833-CalABLE. It's also 833-225-2253. Give us a call. We'd be happy to chat with you about the program, how it works, how to sign up, all those things. The customer service center supports 240 languages. And if you have a hearing impairment, you can call via a relay service. So we do want this to be accessible to folks. You can also get more information about CalABLE. If you go back one, please. Thank you. You can also get more information about CalABLE on our website. You can also scan the QR code here to sign up for emails, newsletters, all those sorts of things. We have a monthly webinar. So each month we have a different topic. The October webinar in a couple weeks is going to be. Let's if we can switch to that flyer. That's the next thing. We have a webinar coming up October 15th. That is specifically for workers. So really walking through what it's like to work and have an ABLE account, some of the benefits, some things to think about, specifically the able to work exemption to the annual contribution limit, all sorts of good stuff. Again, really geared towards workers, but each month we have a different topic. So definitely something you'll want to check out. And in addition, after the webinar, you'll be getting a survey that you can fill out. Let us know a little bit more about you. Let us know what you thought. And then also if you have any questions that we didn't get to, you can put in there. I know there are so many questions in the chat. We will get through as many as we can. Now, some last disclosures to get into. With CalABLE, CalABLE CalABLE does offer investment options. And so investments by their nature carry some level of risk, whether it's CalABLE or any other option you might consider. So that's something you want to keep in mind. If you're choosing those investment options, that does carry the risk of loss. We do have the FDIC insured accounts that's insured up to a specific amount as well to think about. If you go to the next disclosure slide, and more information is on our website. We have a program disclosure statement with a lot more detail, walks through, it's like 200 pages of details on the program and more detail on this type of information as well. Again, thank you everyone for joining. This was huge. We had a huge number of questions. Sorry we couldn't get to all of them, but again, like Madeline said, you can ask questions in the post-webinar survey, and we will respond to as many people as we can. But otherwise, big thank you to our Medi-Cal friends from Department of Healthcare Services. Thank you, Brooke. Thank you, Jonathan, for coming and joining and walking people through how Medi-Cal works and how it works with CalABLE. And thank you for our interpreters as always. Yeah, with that, have a good day. Please sign up for CalABLE accounts. Please reach out to us, to Medi-Cal, if you need anything. And thank you.